Today, I'd like to introduce a paper that compares and analyzes the clinical effectiveness of the hydrophilic NH surface and the SA surface. This study starts from the question, would a hydrophilic surface that achieves secondary stability faster be more effective? Hello, I'm Dr. Kim Yong-jin. The paper I would like to present today focuses on the clinical effectiveness of Osstem's hydrophilic BA surface, which corresponds to the NH surface of hyacinth. Now, if you take a look at this paper, you'll see that it's described as a split-mouth, randomized controlled trial. Understanding the study method helps us to understand the clinical insights we can gain from the results. In dentistry, the split-mouth design is quite common. It means that different surgical techniques or materials are applied to different sides or adjacent sites within the same patient so that we can directly compare their clinical performance and effectiveness. The term randomized controlled trial indicates that the choice of which surgical technique or material to use is not made by the clinician, but rather determined randomly. In this study, the researchers didn't divide the sites into right and left. They selected patients who needed at least 2 implants, assigning each implant site randomly. So one site received the NH surface implant, which we call the BA surface in Korea, and the other received the SA surface implant. In other words, this was an experimental study comparing the clinical usefulness of the hydrophilic NH surface with the SA surface. In this study, each patient received 2 implants, one with an SA surface and the other with an NH surface. ISQ values were measured immediately after placement and at 1, 2, 3, 4, 5, and 6 weeks post-placement. By monitoring the ISQ values every week, we can see how the implant stability changes over time, determining whether it's improving or decreasing over time. As you can see the results, the overall ISQ values were high. There was no statistically significant difference in ISQ between the SA and NH implants. However, what's interesting here is that around weeks 2 and 4, the SA group showed a brief dip of ISQ, whereas the NH group showed no such drop and instead remained steady and trended upward over time. Although the observed decline does not appear clinically significant, even small early differences may later translate into meaningful outcome differences. More specifically, implant stability can be expressed as the sum of primary stability and secondary stability. Primary stability refers to the immediate mechanical interlocking achieved at placement between the implant threads and the residual bone. Secondary stability refers to the subsequent biologic stability that develops through new bone formation and osseointegration around the implant. Following placement, primary stability progressively declines, approaching 0 as osteoclasts resorb the residual bone and initiate bone remodeling. Primary stability largely depends on implant design, whereas the total stability is determined by secondary stability. As primary stability declines and secondary stability increases, a stability dip can inevitably occur. The best way to minimize the dip or bring the recovery earlier is to accelerate the secondary stability. Therefore, if the primary stability is equivalent, total stability will differ depending on whether the surface promotes secondary stability. In the discussion, the main question is why a hydrophilic surface can maintain stability in the early phase without a stability dip. As shown in multiple studies, placement of hydrophilic implant surfaces more rapidly stabilizes the peri-implant blood clot, thereby accelerating angiogenesis and creating a favorable environment for early new bone formation. Because the hydrophilic NH surface can promote a better early bone response, it can provide better results with immediate or early loading. The study concludes that the NH surface may offer greater predictability in patients with poor bone quality or immune-related conditions. This study was conducted in collaboration with Professor Tallarico in Italy, who has been an active key opinion leader for Osstem in the European region. This article was co-authored with Professor Tallarico, and on the basis of this article, we subsequently published a follow-up study with a similar idea. In 2019, we reasoned that if the NH hydrophilic surface achieves high early stability, early loading at 4 weeks may be feasible, rather than waiting the 6 weeks. Accordingly, we wrote a study reporting early loading cases using implants with the hydrophilic NH surface. This was not a comparative study. We used only the hydrophilic NH surface. As in the previous work, ISQ values were recorded at placement and then every week up to 4 weeks. In this case, primary stability was quite high, with a mean ISQ of approximately 75 overall and about 80 in the mandible. In cases demonstrating such high primary stability, we proceeded with 4-week early loading. Just like our earlier findings, there was no drop in ISQ from week 1 through week 4. This does not mean that all cases should undergo 4-week loading. The study suggests that hydrophilic implant surfaces may reduce early implant failures. We hope these results are useful in clinicians' routine implant practice. Thank you.